The news day continues here on One News Now. I'm Charles Lejano. The Health Department says there has been an artificial decline in COVID-19 infections. To give us details, Greg Gregorio reports to us live from Mandaluyong City. Good afternoon again, Greg. First off, what made this recent dip in fresh cases artificial, and when can we expect an actual downtrend?
Yes, Charles, according to Health Undersecretary Maria Rosado Vergere, about 36 testing laboratories did not operate over the weekend. Thus, we had recorded a lower number of COVID-19 positives yesterday. But according to Vergere, we still have at around 10 to 11,000 average new daily cases each day, and we might see the expected decline of cases due to the recently implemented enhanced community quarantine after 10 to 14 days from now. Charles?
Right, Greg, we're seeing more and more vaccines being rolled out. At the same time, more cases of side effects are also being reported. Do we have any updates on this?
Yes, Charles, according to the Health Department, as of April 11, there are 24,823 reported suspected adverse events following immunization, and about 7,000 of these are among those vaccinees who received Sinovac Coronavac. 164 of them have reported some severe side effects, while more vaccinees, or around 17,000 adverse events, were reported among vaccinees who received doses of AstraZeneca's COVID-19 vaccine. But the Health Department highlighted that none of these cases have been identified as directly related to the COVID-19 vaccine so far. Charles?
Right, Greg, what's the latest from the DOH on other COVID-19 treatments such as ivermectin and antibody cocktails?
Charles, first off, on ivermectin, the DOH stands firm on saying that the prescription of ivermectin to a patient is illegal without any proper authorization from the Food and Drug Administration, considering that it is unregistered in the Philippines as of date. And to that antibody cocktail, it is actually the Regeneron that is undergoing a study abroad. And according to the Department of Health, it gives at least 70% on lowering the hospitalization and shortening the hospitalization days of a positive case. But still, because this is a pending study, the Department of Health is monitoring the progress of this report, and they are also hopeful that this could be used in the Philippines to our COVID-19 positive patients. Charles?
Right, Greg, let's talk about the distribution of aid. We have experts saying ayuda distribution is a possible virus super spreader. So what's the plan of the DOH to avoid this?
Yes, Charles, we heard that the Octa research once mentioned that the distribution of ayuda in some local government unit areas is a possible cause of a super spreader event. And the Department of Health mentioned earlier that yes, it is a possible super spreader event, and they have been coordinating with the Department of Interior and local government and reminding local government units to implement other measures such as scheduling to avoid or to prevent a possible super spreader event such as this. Charles?
All right, Greg, we have the Alliance of Health Workers requesting dialogue with President Duterte. Do we have any updates on this?
Yes, Charles, according to Health Undersecretary Vergere, they respect the rights of this Alliance of Health Workers in seeking dialogue with the President. But according to Vergere, they're also coordinating or contacting with sectors of Alliance of Health Workers and other sectors of health workers through the Department of Health Undersecretary Yusek Leopoldo Vega, who also heads the One Hospital Command, to know their concerns and to address them one by one. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong City. A group of doctors and health workers expressed frustration at the government for snubbing their recommendations in battling the pandemic. Dr. Maricar Limpin, a member of the Healthcare Professionals Alliance Against COVID-19, or HPAC, told One News' Agenda that less than 50% of their suggestions are being followed by the IATF. Limpin also said the task force against COVID-19 should be led by someone from the health sector.
Unfortunately, since we are recommendatory only, we are just in being invited, but wala naman hindi necessarily na pakikinggan kami. Iba-iba yung mga tao na nagpupunta no at kumakausap sa task force pero marami sa recommendations namin hindi nasusunod.
Here are other vaccine updates from around the world. India will fast-track the emergency use approvals of Western and Japan-made vaccines, paving the way for possible imports from Moderna, Johnson & Johnson's, and Pfizer. The big vaccine exporter is currently dealing with a second wave of infections and has been reporting daily record highs. The United States Federal Health Agencies recommended to suspend the use of Johnson & Johnson's vaccines for a few days. 6 women below 50 years old reportedly experienced blood clotting after receiving the shot. Johnson & Johnson's will also delay its vaccine rollout in Europe, pending review of extremely rare post-vaccination blood clots. And China's locally developed COVID-19 vaccine, which uses a messenger RNA technology, could begin late-stage clinical trials overseas as early as May. The Middle Kingdom may pick South America as the first trial location for its COVID-19 shot called ARCO-V. Concerns are growing over the lower efficacy rates of China-made COVID-19 vaccines. But given the supply problems worldwide, are these brands still worth a shot? Bloomberg Quick Takes Rachel Chang weighs in.
There is renewed global attention on the fact that the efficacy levels of Chinese vaccines have not reached the levels that we've seen from the mRNA vaccines in Pfizer and Moderna, and even Russia's vaccine. All of these have efficacy levels above 90%, but the Chinese vaccines are ranging between 60-something% to just below 80%. And specific attention is being paid on one Chinese vaccine, Sinovac. This vaccine has been proven in a large-scale Brazil trial to have an efficacy level of just above 50%. 50% is the minimum threshold that regulators will accept for approval. So that is concerning, especially because this is the Chinese vaccine that's been distributed most widely around the world. A lot of developing countries like Brazil and Indonesia are dependent on this vaccine. So questions are starting to mount on how is this going to affect the global immunization effort. But what's also really important to keep in perspective is that the 50% efficacy rate is looking at all symptomatic disease, even mild sickness. And the truth is that all the vaccines we have out there right now, including the Chinese ones, are nearly 100% effective at preventing hospitalization and deaths. And those are the two most important things. Bring down serious sickness, bring down fatalities. We're still going to see that happen around the world, and that's why it's really important for people to keep getting vaccinated, even if the only access they have is to a Chinese vaccine.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Charles Lejano. We're One News.